Friends, as you know that the reproduction in horses is different from other species, and so are the reproductive disorders in the horses. Uh, Today we talk about the different reproductive disorders in the horses and how we can deal with them. Friends, I am Professor Govind Narayan Purohit, the former university head and dean postgraduate studies, Rajuva's Bikaner, and currently the professor and head of clinical complex, Sri Ganganagar Veterinary College, Ganganagar. Right? So, reproductive disorders in horses include the shortness of the breeding season. The horses are long day breeders, as you know, and there is an imposition of January 1st birth date in the thoroughbred horses. Now, this imposes a lot of problems in equine breeding, and the age of the thoroughbred foals and fillies is calculated by the calendar year and not from the date of birth. And during the early breeding season, the cycles are very irregular. Sometimes the mare is in estrus for 25 days. Otherwise, it is off in within 2 days. Again, after 4 days, it comes into estrus. So, during the transition period, the estrus cycle is very irregular. So, this again is a major problem for reproductive failures and then ovulation failures. Then the second is genital infections and abnormalities. Genital infections include the contagious equine metritis, very common in horses. It was first isolated from England and then it has spread to many places of the world. Then there is the coital vesicular exanthema, what is also known as genital pox, and then trypanosoma equipartum. Then non-infectious include the endometritis, the pneumovagina, the defects of the perineum, very common in horses, vaginitis, cervicitis, and then the tumors of the genital tract, congenital abnormalities like cysts, chromosomal abnormalities, and much more. Now, we first discussed the age is reported to have the most significant bearing on the reproductive performance of the horses. And decrease in fertility may be in part due to the increase in transit time for sperm to reach the oviduct. Anovulatory estrus is greater in mares over 20 years of age. So if the mare is over 20 years of age, then the chances of that is much more. Then the third cause for in reproductive disorders is irregularities of the estrous cycle. As we said, there is a males have a long periods of estrus. Maybe the normal period is 4 to 6 days, but some males may have even up to 10 days. Then long diestrus period, irregular periods of estrus, anestrum, delayed ovulation, and nymphomania. These could be the reasons for reproductive failures. So, first we talk of the infectious cause, the contagious equine metritis. It was first reported in England, caused by Tailorella epigenitalis, and it has got venereal and other transmission. The infection and discharge occur from the uterus, and there is a localization of infection on the clitoris. Then the genital pox, it has got venereal transmission caused by equine herpes virus, which do not cause abortion. The papules appear on the vulva in the female and on the glans penis in the male. There is spontaneous recovery within 10 to 14 days. Then Dorine, this is caused by trypanosoma epipertum. It has got venereal transmission, and as you know, there is appearance of dollar plaques, as you can see in this picture, the appearance of the dollar plaques post recovery, and you can find the trypanosomes in the genital discharges, right? Then endometritis. Endometritis in mares is most common because of poor vulvar conformation. And this occurs with the increasing age of the mares. The This may occur because of poor labial muscle tone, abnormalities of the perineum, pathological falling, unhygienic breeding, and another one is persistent mating induced endometritis. The diagnosis of endometritis can be done by rectal and vaginal examination, uterine cytology, uterine biopsy, and all the more using transrectal ultrasound. You can see here, this is a picture from a mare with endometritis, and you can see a lot of endometrial folding and some fluid accumulation within it. The treatment includes antibiotics after sensitivity tests. Episioplasty and perineoplasty is recommended if there are some anatomical defects. Vaginitis and cervicitis is less common in males. Fibrosis of the cervix is uncommon. Cervical incompetence is seen in donkey mares where the cervix fails to seal after a conception. Now, this is one of the most common uh, cause of reproductive failures in males, and that is persistent mating induced endometritis. Uh, the organisms included maybe Streptococcus zoopitamicus, uh, and then hemolytic E. coli, which is second most common cause of uterine infection. Now, persistent mating induced endometritis leads to fluid accumulation, and that is why the uh, in a normal mare, what will happen once the mare has been uh, provided service, then there will be huge volume of semen in the uterus and uterine contractions, and the lymphatic drainage will clear the extra fluid in the uterus. But when a mare is susceptible, then there will be persistent endometritis because there will be poor uh, confirmation, maybe because of poor confirmation, excessive fluid, and there is poor lymphatic drainage. So fluid accumulates inside and the mare does not conceive it, right? Then granulosa cell tumor of the ovary is common in mares and donkey mares. Endometrial cysts are common in older mares and can be diagnosed by ultrasonography or maybe using the endoscopy. And ovarian cysts are uncommon, and ovrectomy is recommended for mares with ovarian cysts. Mucometra is seen in older mares occasionally. Then irregularities of the estrous cycle. Long periods of estrous. 75% of the irregularity uh, occur during the early season when the mare is entering into estrus from the anestrus period of winter. Then the cycle length is very irregular. Long distress periods, infrequent estrus with long periods of diastrum or anestrum. Mare may accept one stallion but may refuse another. Irregular periods of estrum, psychological estrum with no ovulation, and silent estrum, which is common in fatty or lactating mares or heavy draft mares, right? Now, anestrum is physiologic during winter months. Males do not come into estrus during November, December, January. These months, the males do not because the days are short. Males require 16 hours of light and 8 hours of darkness. Then it can occur in pathological emaciated mares during gestation or during lactation. And delayed ovulation is common in shy breeding mares. Nymphomania is of two types in mares, and maybe a mild type or maybe a severe type. And in the most severe types of nymphomanic mare, it may uh, cause harm to the handler, and mostly it is suggested that nymphomania may occur because of pituitary tumors, and the euthanasia of such animals is suggested. Then for anestrum treatment, domperidone, 1 milligram per kg orally is suggested. If the mare is not showing signs of estrus, the most useful drug will be administration of domperidone orally, 1 milligram per kg for a period of 7 to 10 days. So here are some of the uh, drugs that have been suggested uh, by Patrick McHugh, and this include the domperidone, sulpiride, and other things where you can go through this the PDF of uh, this complete lecture by going to GNP Sir classes, and when you download the GNP Sir classes, you will find that there are most of our lectures are there in the free material section in the GNP Sir classes. So you can go there, you can download them, you can read them, right? Then management factors affecting fertility in the mares. What are the management factors affecting the equine fertility? The teasing program is one of the key management factor which will determine the fertility of the mares. Mare should be teasing should be begun 30 days prior to season, and polling mares teasing must be begun from day third of polling. And we have talked how teasing can be safely done in one of our previous lecture. So teasing is an important. A stud manager has the responsibility of teasing mares regularly, daily morning, daily evening, maintaining the records, and then providing the service using the stallion at the appropriate time. He can take help of the vet, and a vet can tell him what would be the appropriate time to provide the service by the stallion, right? So teasing is very important, and mares should be teased daily, morning and evening uh, during the breeding season. Then breeding at the optimum time. So what is breeding at the optimum time? Breeding at the physiologic season. If you want to breed the mare during December, maybe it will not conceive. During the early season or during the transition period, when the mares are entering into estrus from the anestrus of December, so during the months of February, the cycles will be very irregular. So, and when these a mare may remain in estrus for very long period, it may remain in estrus for 10 days, 20 days, sometimes even 30 days, and or it may be in estrus for 2 days, and then estrus has gone, and then after 5 days, again the mare has come into estrus, and again it remains in estrus for 2 days, and then again the estrus has gone. So during the transition period, the estrus cycle is very regular. So what is being done? That artificial bulb is laid in the stable so as to make 16 hours of light available to the eyes of the mares. And then feeding for weight gain, breeding based on rectal palpation or ultrasound. You see, usually the stud managers, they provide a service every alternate day. Say the estrus period of male is 4 to 6 days. So what he does, he starts giving a service every alternate day, starting from day 2 of estrus. And so by day 6, he will provide around 3 coverings. This can be avoided by taking help of a professionally vet who can detect the size of the follicle. Any follicle which is less than uh, 2.5 or say 3 centimeter will the it will not ovulate. So the covering you have provided will go waste. So whenever a clinicians palpating the follicle or visualizing it by ultrasound, they find that it is 3 centimeter or more, and the shape of the follicle has become pear shape. So at that time they can advise the covering. So that way breeding based on the veterinary advice. And then careful breeding of foaling mares. Usually foaling mares are bred Falling mares are bred during the whole heat period, which comes around within 10 days. But it is being said that do not breed your mare before the 10 days. So, what to do? Start a oral progesterone simply from the day of falling. So, when you start giving progesterone, then from the day of falling and give it for 10 days. So for 10 days, the mare will not return to estrus. And when you stop it, the mare returns to estrus within 5 to 7 days. Then washing the genitals before service is very important. One should clean the genitals of the stallion, and the mare should be disease free. These are important. A major problem with the stud farms is the vulvar conformation. You can see here, and there is a vulvar tonometer which can detect the angle of the vulva. So these under such condition, a common this is not a right conformation. This is a poor conformation. Again, this one is a poor conformation. So both these types of mares with both these types of structures will require a Caslick operation, or what is called the vulvoplasty. You have to inject local anesthesia on the vulvar lips, and then xylocaine, 2% xylocaine, and then taking a scissor, you have to cut parts of the vulvar lip from the upper portion, from this portion, and then suture it so that the uh, air getting inside will stop and the mare will become pregnant. But these Catholic sutures have to be opened during holy, right? Then abortion in mares. EHV1 is the most common cause of abortion in mares, and it is being said that any mare aborting at 4 months or more, it should be considered to be because of EHV1 until proven otherwise. Until it has been proven that this is not a EHV1 abortion, you should consider it to be because of EHV1 abortion. Then in equine infectious anemia, Streptococcus zoopitamicus, Salmonella abortus equi, these are the common uh, abortion causing agents for mares. And twins again, twins are undesirable in the equine species. And so if the vet can detect the twins by transrectal palpation or maybe by using transrectal ultrasound, a technique used to reduce the twins is transvaginal or transabdominal ultrasound guided uh, this amniotic vesicle aspiration. Amniotic vesicle aspiration. You aspirate the contents of one of the amniotic, say there are two amniotic vesicles, and you want to remove one of them. So you have to aspirate the contents by fine needle attached to the ultrasound. And this ultrasound, you have to pierce that amniotic vesicle, suck the fluid inside, and then you can inject this potassium chloride to just kill this one embryo. And the second one, to save that one, you have to administer non-steroidal anti-inflammatory drugs to prevent the prostaglandin release, right? Equine herpes virus is preceded by respiratory disease in young foals. Usually at the start, there is a history of respiratory disease in young foals, followed by abortion storms and fever, nasal discharge in foals for 2 to 5 days. So, if such type of signs are shown by polls in the start, one should be careful and one should start vaccinating your mares using the vaccine which is available not in India but at other places it is available, Pneumabot or maybe any other vaccine that is available at 3, 5, and 7 months. The abortions beyond 7 months are asymptomatic and neurologic disease may appear later. The diagnosis by virus isolation from nasal swabs, samples of fetal lung, liver, spleen, and thymus should be sent to the lab. And for control, segregate and vaccination of pregnant male, 5, 7, and 9 months. Immunity is short. That tetanus toxoid should be given annually and 4 to 6 weeks prior to polling, on the day of polling, or you can use tetanus toxoid 25 to 30 LF units or TAT 1500 international units. And then are combined vaccines such as the Prodigy, which can be given 3, 5, and 7 months. Now we talk about the special equine fertility problems. First is the imposition of the breeding season. In the thoroughbred industry, the breeding season is restricted from 15th of Feb to 15th of Feb to 30th of June at some places, and to 30th of July in other places. So this is a restricted breeding season. Any foal, any mare should not be bred beyond or before this period. And as you know that during February, that is the transition period. So there will be poor fertility during the transition period and with irregular cycles, long distress, early embryonic deaths, absorptions. These will be the problems. Now, another problem is absorption, what is also known as the early embryonic deaths in mares. Embryonic deaths, or can they have, it is being said that the mare was previously having a pregnancy, but it absorbed the fetus. Now, this is early embryonic death. Early embryonic death. This early embryonic deaths, that is why if you are performing a pregnancy diagnosis at 17 days or 18 days or 20 days, you should ask the owner to confirm it at day 43, right? Then fluid accumulations post mating, as we discussed earlier, that with increasing age, the lacteals draining out the fluid or accumulating in the uterus is it is lowered down, and for that what you have to do, 6 hours after your last covering, you can administer a dose of oxytocin or a dose of prostaglandin, and then the uterus will be cleared of the fluid accumulation. Then failure of timely ovulation, maybe the mare is not ovulating timely, so what to do for uh, the assuring timely ovulation? There are two, three things. First is that when you are providing a covering, the follicle should be at least 30 centimeter in diameter. Then what you can do even if mare is having a 30 centimeter diameter follicle, it will not ovulate. So what you can do, when 48 hours before a covering, or before, if you are going to do artificial insemination, then 48 hours before the covering, you give a dose of HCG. But mind it, HCG can result into Thales disease, so use it carefully. Then, as we talked, that mares at the whole heat have a poor fertility. So, what we can do is oral administration of progesterone. Adrenojust is available at some places, and you can administer from the day of foaling to prolong the first foal heat or foal heat by more than 10 days. Then abortion due to twins and herpes virus. For twins, we have already talked. For herpes virus, vaccines are available. So, what are the advancements in infertility treatments for male? Artificial lighting. Artificial lighting, 16 hours light, 8 hours darkness. So, what you can do from 1st of December, start lighting a bulb 1 month ahead of the transition period. And this will result into estrus in mares in January. And during January, the irregular estrus cycles will come in. And from February, the regular estrus cycles will start. Then, with the same intent, there has been the blue light masks which are applied, and they can replace the lighting of the bulbs. You can see in these pictures, these are the blue light masks you apply on the equine eye, and they will act just like your 60-watt incandescent bulb. Then hormone assays. the mare's failure to show ovulatory estrous cycle during the breeding season was a common cause of occurrence of prolonged estrus, spontaneous prolongation of the cyclical CL in the absence of pregnancy. This condition occurs at least once during the year in as many as 25% of the mares when the CL persists in the ovary and secrete progesterone for some 80 to 90 days. So hormone assays have like ELISA and automated systems can rapidly and accurately diagnose the persistence of active luteal tissue in the mare's ovary and treat them accordingly with prostaglandins. Oral progestagens, altrinogest to mimic the biological actions of exogenous progesterone and progesterone use in mares more frequently to regulate pregnancy and estrus, right? Altrangbolol. Altrinogest is administered orally to mares 1 ml per 110 pounds or 0.044 milligram per kg. This can be used to avoid the pregnancy loss, estrus postponement, estrus suppression in show or jumping mares. Then for ovulation failures, the GnRH analogs like Receptal have shown very poor response in the equine species. And use of SCG, there is danger of the development of the thallus. So there is new is the GnRH analog Dasloralin 2.1 milligram. When incorporated into a slow release subcutaneous implant, proved highly efficacious in hastening and inducing ovulation some 40 to 42 hours after administration. Right? The implant should be removed once ovulation has occurred, otherwise, it results in an extended interovulatory period. So, this is a implant. Then post-breeding endometritis, some advancements include traditionally saline was infused followed by oxytocin injection. But now recently DMSO, dimethyl sulfoxide, infused with 30% of 30 to 60 ml of DMSO after breeding has shown good promise. Then use of acetylcysteine, N-acetylcysteine is a mucolytic drug. Males receiving 0.6% solution of N-acetylcysteine the cycle before or in 48 hours before breeding, in addition to conventional treatments, helped in fertility improvement in males. So you can try an acetylcysteine. It is available in the medical field. It is currently not available for the veterinary field in India at least. So you can use Mucinex, which is available for medical 600, and dissolve it in distilled water and infuse intrauterine. Then there is a problem of biofilm associated bacterial endometritis in many. You are treating the mare and it is not responding. So because the microbes are causing a creating a biofilm protecting themselves. So infusion of buffer chelators such as 250 to 500 ml of tricide or tricidTA into the uterus on day 1 and lavage of the uterus to remove the solution within 24 hours and examination of the reflex has been suggested. So here are some of the combinations which can be used for uh, endometritis treatment of mares which have the microbes forming a biofilm problem. You can find this in the PDF of this lecture in GNP Sir classes. Kindly download the GNP Sir classes. Go to the GNP Sir classes app and you will find this lecture there. Then modulation of the inflammatory response, single dose of 50 milligram IV dexamethasone within an hour of mating or daily prednisolone given before and after mating. These can have also shown some promise. Then another problem for mares is placentitis. It affects 3 to 5% of pregnant mares. There is huge vaginal discharge, udder enlargement, and the birth of septic pools. Antibiotics such as gentamicin have been suggested, and then pentoxifillin 400 milligram to be given at the dose rate of 8.5 milligram every 12 hours have been suggested for placentitis. And then followed combined with dexamethasone given over 6 days, decreasing doses. Then neoplasia of the vulva and perineum, most common is squamous cell carcinoma and melanoma, seen in many breeds. Melanoma is common in the perineal, perianal, and tail region of gray horses above 15 years of age. They are typical black masses and may be benign or metastatic. Then uterine lavage is suggested for therapy of endometritis and for uterine infections using a long catheter and a bi-junction tubing along with the infusion bottle. And this will require a very long catheter. And this catheter, you can use uh, the polycatheter, a very longer one, and then place it in the uterus and perform the uterine lavage. Infuse fluid inside the uterus, let it come out until the efflux is clear. You go on infusing the fluid in the uterus, right? Then ultrasonography again is an advancement, and you can visualize the follicles, you can visualize the CL, you can visualize the anovulatory follicle with the ecogenic strands. Here are the ecogenic strands. Then endometrial folding, you can see the endometrial folding, which is characteristic of estrus. You can see the twin amniotic vesicles, and you can diagnose the sex of the male by the genital tubercle, right? Then hysteroscopy and laparoscopy have been used in the equine species very well. Endometrial cyst and fibrous adhesions uh, can be assessed, and site-directed endometrial biopsies can be uh, performed, and then laser-guided photoablation of such type of cyst, laser-guided photoablation of the endometrial cyst can also be performed. Laparoscopic examination of the uterus and ovaries can be performed. Then visual laser photoablation, as I talked earlier, ablation of intrauterine fibrous adhesions. Then low dose hysteroscopic examination of fresh or frozen thawed spermatozoa can be done in the equine species. Here you can see the endoscopic pictures of the uterotubal junction, and then this is a ball. There was a practice to place the marble balls inside the uterus and to prevent infertility of the mare. And you can see if they are kept in longer time, they cause damage to the uterine endometrium. And in this picture, you can see the fibrous bands formed here, and these can be removed, or the some growths on the endometrium can be visualized using the uh, endoscope. A more recent application has been to use laparoscopy to apply prostaglandin E2 gel to the whole length of equine oviduct to presumptively unblock the oviducts of infertile males. You see, in the mare, if the ova is unfertilized, then it will never enter the uterus. But if it is fertilized, it will not enter, it will always fertilize. If it is fertilized, it will enter the uterus. So thank you very much. Find my lectures at GNP Sir classes. Download this app. Go to the uh, Play Store and you can find the GNP Sir classes app. Download it and go to the free material section, and you will find all my lectures, including the today's lecture. Thank you very much. Give your likes. Give your comments. Give your likes, give your comments, and share and subscribe to my channel GNP Sir. Hope we brought useful information for you. And if you wish that I bring more and more information for you, kindly do subscribe to my channel. Turn on the notifications. Hit the bell icon. Thank you very much. See you. Bye bye.